1 out of every 8 members of our community has served in the military, and each year the number of veterans in our community rises. And as veteran numbers increase, the facilities in place which take care of their health needs has become too small. The Guam and Regional Healthcare Council Chairman Peter Skro.
With the new Naval Hospital, there's only 42 beds. It's not the fault of the Navies. It's what Congress gave them. That's all they had. But it really has never been the obligation of the Navy to care for veterans. It should be Veterans Affairs. And based on the lower number of beds, there's only one psychiatrist to deal with PTSD. Their specialized needs different from the other population in terms of health care for our veterans.
The Guam and Regional Healthcare Council has come up with a concept to improve health care for Guam veterans and veterans in the region, as they envision a Veterans Center of Excellence, which would include a Veterans Hospital, Veterans Behavioral Center, and a larger Veterans Clinic. In addition, they are also working on air evacuation transportation for veterans in need of off-island medical treatment. As it stands, if a veteran is in need of an air evacuation for medical reasons, they rely on Andersen Air Force Base, and that can cost up to $300,000. The group is hoping to break ground within the next 4 years using private funding.
We already have investors willing to do this, and also the operations and management of all 3 facilities. We also have a management group that has over 50 years of experience in developing and managing hospitals. They actually own about 127 hospitals throughout the world.
Skro says that by having a management group with this type of experience, the quality of care that we offered at the VA medical facilities will be top notch. He says that former Assistant Secretary of the Navy B.J. Penn is their advisor and will be talking to members of the Congress. Skro adds that there will come a point where they will want to take 100 veterans to Washington, D.C., as it could take congressional approval to make their concept a reality, despite that it will be all privately funded. In fact, he says they have already begun discussions with the Hawaii-based Veterans Affairs Office and will be traveling there in 10 days to present the concept, a concept he believes Hawaii and the San Francisco Veterans Affairs offices are interested in. Here on the home front, Congresswoman Madeline Bordallo says she is in full support.
Right now, the climate in Congress, the U.S. Congress, is to do everything we can to help the veterans. There's been stories, that they haven't been treated well and with health care and finding jobs, and some of them are homeless even. So the climate couldn't be any better than it is right now to be able to work on something like this, a hospital for Guam, Veterans Hospital.
She adds that she is trying to obtain funding for the expansion of the Veterans Clinic. Bordallo says she will be helping in whatever way is needed. However, admits that there are a lot of challenges ahead, but it will fill a very necessary need. Reporting for Guam's News Network, I'm Jolene Toves.